basically helped open San Diego Unified School District with a number of other experts, including Dr. Schooley and Dr. Terrace, who will comment after I get through sort of the overview. It is possible. I mean, this was done last spring, but it was pre-Delta. So everything is harder now, just because there's just can be so much more virus in the air. But I think a lot of people, when they hear us concerned about masks, people will say, oh, they take away our freedom. They let kids go back to school now in this mess. It's the only way kids should be going back to school. But there's other things we can do, and that's related to the layers. And so we required masks indoor. They required masks indoors at all times. You've heard about ventilation with CO2 measurements. There's some people say, oh, ventilation is expensive. Opening doors and windows and knowing to ask if you're bringing in fresh air through the HVAC system is free, right? So it's just the knowledge and the awareness, and that's what I hope we're giving to you today. You've heard about standalone HEPA filters, which just brings down the virus levels in the air, all aerosols. In fact, as we get into we're going to talk about this a little bit, but wildfire smoke. What do? We can't open the windows because we bring in all the smoke. This was a problem last year. These HEPA filters will take out air pollution, wildfires. I mean, they're a great investment to help clean the air in kids' schools post-COVID when we get there. So, we checked that with particle sensors. And so this is just some ideas. And again, I'm working on a paper to get this out to the public. But basically, this is the pad they created. I just told them, you better clean the air, and they did it. And then some. They ordered 10,000 HEPA filters, put them in every room. But you don't always have to put them in every room. If you have rooms that have, as was mentioned, good ventilation, then you can, you have to figure it out, right? And so that's a pretty simple thing to do. This is the indoor purple air sensor. This is a AirNet sensor for looking at CO2 levels. This is the panel. They would send me the data. This is the particle data in each classroom to see, and they could see when it went high. And then one time, they went and saw that the teacher had said it was too noisy at that time, so I turned it off. Turned it back on, the levels go back down. You can actually really clean the air. They also, I have to say that one of the most important things for those of you dealing with this in schools is that you have to be transparent. You have to tell the public what you're doing to clean the air. Don't just say, oh, we've got this. Yes, we're following CDC guidance. That's just not enough to calm people down. So people actually enjoyed, this is a green spotlight. This actually has a sensor on it to show you the CO2 is in the green zone. It just gives peace of mind. So you don't have to, because it's invisible, so you can't really be sure what you're breathing. And so again, just work with the public, because everybody is nervous at this time. So the other thing is, sort of stepping through to the other things that were added in. There was a number of questions about, the riskiest time is lunch. And we'll talk more about this, I'm sure, through the day. The dream would be kids not talking, I don't know, show a movie outside or something. That speaking and yelling is what starts to release it into the room at higher levels. We had small cohorts, and we could have 6 feet distancing. That's going to go away in the fall. As I say, with Delta, that's a concern. So, I'm going to breathe a lot easier for all of your kids and everyone's kids when the vaccine is approved for less than 12. And then the question will become the vaccine policy for everybody. I hope so. Indoor mask mandates right now are critical, as I made the case. I think we've made the case even for the vaccinated. I also helped reopen UC or not reopen. We never really completely closed, but we had a huge, and that's a whole nother talk, effort called the Return to Learn effort, and we were successful as a large university. But one of the really important things, and I think schools have to think about this too, is free or cheap testing. And so, these rapid tests, I think are underutilized. So there's all kinds of things that we need to be thinking about, taking on this extra challenge of Delta that we didn't have. But I will tell you, San Diego Unified has over 100,000 kids, and they didn't have any outbreaks. And so it is possible, but we live in San Diego. And so we were able to use clean air, get clean air relatively easily. So I just want to quickly mention, and then I'll hand it off. I'll have sort of get you the perspective of Howard, or Dr. Terrace, who led the effort, and a parent who also had to go through the whole thing. But one of the things I just want to point out is that clear guidance has to be given for addressing aerosol inhalation. Plexi was everybody's favorite. It makes people feel good. it does block people from coughing and sneezing spray on you, which is good. And if kids are too close, it's good. But we also have to be aware that it can trap the aerosols. Just think about putting up a plexiglass barrier and having someone smoking on the other side. It's going to just go right over the top, and it can actually get trapped, and that can be problematic. You've already heard about the other things that we need to sort of not focus so much on and think about cleaning the air more than we have. And this idea of ventilation is what they did in 1918 in schools. Dr. Corsi showed the same figure. They had it figured out. They had all the same rules that we're just coming up with now back then. So I'm going to, now I would like to just sort of ask Dr. Terrace, who is the leader, who is the consultant that works with UC, he's a doctor at UC San Diego, but he was also the person that worked and led the efforts at San Diego Unified. So Dr. Terrace, it would be great if you could just sort of make a few comments about sort of your experience in dealing with this school opening and what you learned that maybe you could share with people, about how you figured out which spaces did you treat all the spaces the same? Did you how did you figure that out? And I think a burning question for many people is, as a person sort of advising people, how hard was it to mandate masks?
Right. Well, I will tell you that the way that we first started is to really explain to people what aerosol transmission was. Dr. Prather had given us the smoke analogy. And I ended up using that in many, many slides as I spoke to school nurses and to school administrative leaders, because people understand that smoke, even if it's invisible and odorless, is something they can imagine. And I just kept saying, imagine we're all breathing smoke, and how are you going to lower that smoke level even though you can't see it or smell it? And that gave people some perspective. We did purchase a lot of these room air purifiers, and we were dealing with a situation where we didn't have children in the classrooms breathing, and yet we had to estimate how many particles they were going to put in the air and how they were going to get rid of it. Last year it was easy because it was hybrid learning, so we only had 15 kids in a classroom. This year we have 30 kids in a classroom. And Dr. Prather kind of explained to us, and that's why we bought all these purple particulate air monitors and carbon dioxide monitors. She explained to us how we can understand how the air is going to be moved in any one classroom by using these monitors and using candles, using dry ice, using things that produce particulate. The question was, did we do the same thing in every building? No, because some of our buildings had really very good HVACs that would fit the MERV 13. So those were fine. And we could see they were fine because when we put particles in the air, either with real people or with some of these fake ways, we could see it go down as soon as you turned on the AC. For other buildings that were old or couldn't take MERV 13 filters, or we couldn't purchase any more MERV 13 filters, that's where we bought the HEPAs. We also have some places where there's very, very old buildings, very poor ventilation. We have gymnasiums, and that's where the dry ice really worked. We were able to fill it up with particles and then see how quickly we can reduce that to a very low particulate safe level. The second question was regarding masks. Fortunately, California, the state of California, has now mandated masks for all people inside schools. Until then, we were using education to convince our board members of why they should adopt that. And again, using the smoke technique. If you get it at the source, you're not going to have to deal with all this air cleansing because you've prevented the air from becoming filled up in the first place. California, luckily, is the kind of state that just said everyone indoors has to be that. There are exceptions, though. We have a huge number of children who are getting doctor's notes saying they can't wear a mask because of medical reasons. we have found that probably 80% of those are bogus notes. The doctor has never tried a mask on them. They've never tried various different kinds of masks, inserts that have filters that take it away from kids who have sensory defensiveness. They didn't give kids with behavioral or mental health problems a chance to have positive feedback when they keep their mask on. When we take the power out of those doctors' notes, we require a doctor's note, but then you also put the power into the school teacher, the school physical therapist, the school occupational therapist. And you say, before we give you a medical mask exemption, you got to go through our team. We got to work with your child for an hour or two to see how we can get that child to actually wear a mask. Until that process has occurred, that child does not get a mask exemption. And so that has greatly reduced the number of children who aren't wearing masks in our school buses and in our classrooms.
Great. Okay, well, we'll have a quick comment just from a parent. I had a lot of parents actually volunteer to comment on their experience, and we'll hear from Ian Ricksecker now.
Hi, everyone. My name is Ian Ricksecker, and I have 20 years software engineering experience with a specialty in security and risk management. I'm also the father of a 9-year-old in a San Diego Unified Elementary School. Last March, my ex and I faced an impossible dilemma. At home, we have a 3-generation family, and my mother is taking immune suppressant medication. In the first 2 quarters of remote learning, our daughter was doing very well, but we had just had our parent-teacher conference, and her performance had dropped dramatically. When San Diego Unified announced that they were reopening, we were stuck with the choice: risk my mom's life on a bet that school was safe, or keep our daughter remote when that clearly wasn't working for her. And if the worst happened, would our daughter blame herself for killing her Bubba? When I learned that Dr. Prather advocated opening schools, well, I was very critical. Then I studied her recommendations. I studied airborne spread, mitigation, and ventilation. And when I reached out to my principal, thanks to the work that Dr. Prather and Dr. Taras had done, to ask if we had MERV 13 filtration, she was already up to speed. She answered, "No, given the age of our school, there are compatibility issues with installing MERV 13. That said, I have the district HVAC crew out today trying a test to see if they can make it work. We already have 2 HEPA filters in every classroom and 1 in any back room that a student might access. We're planning for 5 air exchanges per hour." I cannot tell you how reassuring that was as a risk management expert, as a security expert, and most importantly, as a parent. Those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety is oft quoted in opposition of NPIs, including the measures that are advocated in this presentation to ensure school safety. To my daughter, essential liberty is the liberty to attend school with her classmates without worrying that she might infect or kill her Bubba. Thank you.